Are your eyes irritated, itchy, and burning? Do you sometimes have swollen eyes and eyelids? These symptoms are often attributed to allergy season, but can be caused by other factors in the environment. If you're one of the many who suffer from itchy eyes, understanding the cause is key to treatment and relief. And in today's video, we'll go over 5 tips for treating itchy red eyes. Welcome back to Eye School with me, Dr. D, where I teach you about products and treatments related to dry eye syndrome and eye beauty so you can have healthy, beautiful, comfortable eyes. And before you go today, if you like today's video, I would love it if you would give a love tap on the subscribe button to stay up to date with all the latest eye tips and tricks I have for you. All right, so first let's talk about why your eyes are so red and itchy. Eye allergies can happen, whether they're seasonal or year-round, and that's usually what causes itchy eyes. Allergies can be triggered by pollen or pet dander, irritants like dust and smoke, or products like lotions, makeup, or contact lens solutions. An allergist can conduct an allergy test to determine the specific allergens that cause you discomfort. But in today's video, I've got 5 tips for you if your eyes are getting red or itchy. Number 1, don't rub your eyes. The most obvious measure to take may be the most difficult. It is so, like when your eyes itch, you just want to rub them, but you have to avoid rubbing your eyes. If you rub your already irritated eyes, you can add more allergens such as pollens and pet dander. Constant rubbing of the eyes can even cause a break in the top corneal layer, the epithelium, which causes pain and potentially could lead to infection. It also can it can cause more infection, it can cause more irritation. It's just not good to rub your eyes when they itch. Number 2 is try to determine the allergy or irritation. So once allergies are determined to be the cause of your itchy eyes, you and your doctor can work together to find the treatment plan that works best for you. The most common cause of itchy eyes is an allergy. They can be triggered by pollen, animal fur, mold, dust mites, makeup, or eye drops. And the body is reacting to that trigger by releasing histamine, causing the blood vessels in the eye to dilate and irritating the nerve endings so the eyes water. When the eyes get red because of an allergy, it is known as allergic conjunctivitis. And the tendency is to call all red eyes pink eye or red eye, right? And the common misconception is that any pink eye, it's pink eye and it's contagious and you have to take precautions. But sometimes allergic conjunctivitis is really occurring. Now it tends to be more common at certain times of the year, like right now, I'm filming this in March in North Carolina. My car is covered in a yellow fine dust. So even though you can have allergic conjunctivitis all year, but it's also incredibly common to get it sort of during that, where I live, like February, March, or even in the fall during like ragweed season. You can also have the runny nose, the scratchy throat, the sneezing, the postnasal drip, but you don't always have one or the other. Some of my patients will only have ocular allergies. Some express their allergies as sort of that postnasal drip and upper respiratory. And sometimes it'll change on a person. They'll have the upper respiratory most of their life and go, why am I having eye allergies now? There's also some other types of allergic conjunctivitis, like atopic keratoconjunctivitis. That produces an inflammation of the surface of the eye because of an allergy to a specific substance. Another condition, vernal keratoconjunctivitis, VKC, produces inflammation in the membrane on the surface of the eye. That's usually in young boys. So if you have a son that has a lot of issues with allergies, it could be VKC. Also, eczema, a form of dermatitis around the eyes, can cause itching and redness and this ocular discomfort. But we can also have itchy eyes because of dry eye syndrome, when you don't produce enough of the right kind of tears to keep the surface of your eye moist and comfortable. You could also have an object or chemical in your eye or blepharitis that causes inflammation of the eyelids and then itchiness of the eyes. You can also have itchiness from like contact lenses, reactions to medications, whether those are systemic medications or topical. But I did want to say, before I move on to the next point, is that sometimes if you are a dry eye patient watching this channel and all of a sudden you have allergies, or you're an allergy patient feeling like you have dry eyes, there's a connection there. It seems as though The pore tear film that we have from dry eye sort of makes us more susceptible to allergens and vice versa. Allergy can cause these dry eye symptoms. And so sometimes patients will have a really tough spring and then get into that chronic dry eye cycle. So keep in mind that if you have dry eyes, you need to be on guard for allergies and vice versa. So my third tip is to start with some natural things. So really just trying to avoid the allergen, remove it from the picture. Protective measures during the high pollen season can go a long way. What do I mean by that? Close your windows in your car. Oh my gosh, I put my windows down yesterday. It's so nice when it starts getting warm to put those windows down and enjoy that weather and that wind. Oh, it's the best. But the pollen is real. So potentially keep your windows closed in your car and at home. You can wear wraparound sunglasses. A lot of my dry eye patients are like shocked when I tell them this, but it's such an underutilized trick to just use really great big temple wraparound sunglasses to avoid contact with pollen and also keep the wind out if you have dry eye. You can also use a dehumidifier at home to control potential mold in your home if that's the allergen. I also would recommend showering or washing your face right after you mow the lawn, like removing whatever hat you were wearing, right? Because there could be pollen on that hat. So if you just mowed the lawn in the spring, get that hat off, get it in the wash and maybe shower, wash your face just to get all that extra pollen away from you. Be sure to wash your hands after patting any animals. Change your bedding more frequently during allergy season. Employ contact lens hygiene, always, 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 and forever. Please use contact lens hygiene. If you wear contacts, part of your job is to change them as often as prescribed. It's also your job to clean them if they're the lenses you have to clean. Now, if you wear dailies, you don't have to do that. And one thing to consider is that maybe if you're a monthly contact lens wearer during allergy season, you could wear them daily. Allergens as well as bacterial products stick to contact lenses, so it's really important to change them as you're supposed to. You can also wash out your eyes with artificial tears. There's no harm in that, but if you are a dry eye patient, I'd be just looking for the ones with no preservatives, so Optase is one of my favorites. And make sure to rub your contact lenses when you clean them every night. Wash the case, change the solution inside every day. Do not top off with solution. If you don't know what that is, I'm not gonna tell you. Don't do it. Don't top off your solution. Fresh solution every day. Okay, another thing I love for allergy season are cold compresses. If you deal with mild allergies, cool cloths, cool compresses over the eyes can really help ease that discomfort. You can use castor oil drops at night. They have to be organic, they have to be high grade, but you can use castor oil drops to help reduce eye irritation during allergy season. This is a good thing to use at night right before going to bed because it will blur your vision. You could also try the Optase MGD eye drops, nice and thick, has an oil in it, very soothing to the eyes. Aloe vera. Now aloe vera, if you can tolerate it, has some anti-inflammatory and antibacterial properties, and there are natural healers that recommend using it to alleviate sore eyes. I'm not into this. I'm not into putting this in your eye, okay? But if your skin is really irritated, I will tell you that I use aloe gel in a 50-50 mix with ultrasound gel, and that's my medium for IPL. And I'll link the one that I use that has apple stem cells and manuka honey. And I made a whole video about manuka honey as well. I need to make a video about this aloe because I think it can actually be really, really good for rosacea skin, skin that's sensitive, and potentially even during allergy season with inflammation. It's a good product, so I'll link it above, but it's got a lot of good things in it. You can use it around the eyes, but I would not recommend using it in the eye. A more aggressive treatment plan for itchy eyelid relief is like actively using artificial tears, non-preserved obviously, cleansing the face with Eye Safe Wash. The Zigglers make great stuff, so I'll link their shop right here. Using anti-allergy drops. Pataday is now over the counter. We used to have Aloe and Zaditor. Still not bad, still better than the ones that get the red out and shrink the blood vessels, but I really love Pataday. Pataday Extra Strength, 0.7%. That's Pazeo. That's the old Pazeo that I used to prescribe. And so you can pick that up for allergy relief and use it once a day. And they're safe to use year round or just during allergy season. The only caution with all of these allergy medications is they tend to be drying. And so if you have really bad dry eye as well, you just have to be very, very careful. You can also use oral anti-allergy medication, but again, it can be very drying to the eyes. An allergist can give you allergy immunotherapy, sublingual, you know, the pills, the tablets that you take, or allergy drops. This is like a very personalized treatment that treats you with the allergens that you're sensitized to. So obviously this requires a referral from your optometrist or ophthalmologist to go to an allergist. And I do that all the time for my dry eye patients because there's often an allergy component. And so if you've done all that and it's not helping, you can see your eye doctor to see if there's another cause of the allergies, right? So if you've tried the over-the-counter stuff, maybe it's more dry eye. Maybe you truly do have blepharitis, dry eye, or something like that, or even ocular rosacea that's contributing to your symptoms. Another treatment that's great, I love Zocular. The Zocular products are great too, and the Zigglers are great because they let me talk about everything that I think works. And Zocular is wonderful. It's an okra-based polysaccharide. I'll link the video I did about that as well, but very anti-inflammatory. And at the root of it, allergy and dry eye are both inflammation, right? So we want to do things that are anti-inflammatory, even anti-inflammatory diets, all of that. So ask me more questions about that if you have them. Know that eye allergies are everywhere. There are so many people that deal with this. It is coming into my clinic like crazy right now. And so I hope that those little tips helped just a little bit. If you need more help, please leave a message down below. I can't give medical advice, but I can certainly answer your questions and encourage you to see your doctor. So that's it for today's iSchool. Class is dismissed.